Hi, it's Dr. Lewis Clark. I want to talk to you today about your thyroid gland and about what normal and healthy thyroid function looks like and where thyroid function can go wrong and what are some natural solutions that you can do to help it recover and to restore normal, healthy thyroid function. So before we get into all that, let me just give you a few of the most common symptoms of low thyroid function to see if this may be what's going on with you. Number one, most people don't think about this, but number one with thyroid is brain fog. Number two is depression. Number three is constipation. So every part of your body, every cell of your body is affected by thyroid. Every cell has a thyroid receptor and therefore needs thyroid hormone. Also, you can have things obviously like weight gain and hair loss, coldness, muscle spasms. There's a long list of different symptoms that can be affected. But remember this, the organ that's going to be affected the most by low thyroid function is going to be your brain. And so most of the most common symptoms are brain related. So let's talk about how the thyroid works, and then I'll go through some things about what you can do to help recover, okay? So first of all, the thyroid gland, a healthy thyroid gland function begins in the brain. There's an area in the brain called the hypothalamus, right here in the middle part of the brain. This part of the brain senses hormone levels and then either says make more hormone or don't make hormone, okay? So the hypothalamus talks to the pituitary gland, which is a gland right here in the sella turcica in your brain, and this gland produces what's called TSH. TSH is thyroid stimulating hormone. You're probably familiar with that if you've had any thyroid tests done. This is typically what medical doctors look at. Unfortunately, that's typically all they look at. So the TSH stimulates your thyroid gland here in your neck to produce thyroid hormone. And there are two main thyroid hormones. One is T4, one is T3. Now, of these, 93% of what is made is T4, 7% is T3. However, T3 is the active form. So what that means is if you have T4 but it's not converted to T3, it cannot get into the cell and therefore it's not effective. So this T4 must be converted to T3. How's that going to happen? Well, first of all, it's going to have to be transported through the blood to the liver. Your liver is going to convert 60% of the T4 to T3. Now, to get transported, this T4 is going to have to get on a protein called thyroid binding globulin, TBG. TBG is the escort that's going to give the thyroid hormone a ride to where it's supposed to be. So this hormone is going to go to the liver. It's going to be converted from T4 to T3. Some of it is not going to be converted here, and it's going to go into the intestine or into the gut, and 20% of your T4 will also be converted in the gut. However, for this conversion to happen, you must have three things. You must have good hydrochloric acid production, you must have probiotics, and you must have sulfur, okay? And that can be affected by genetics sometimes. And of course, these other things can affect digestion. So if this happens properly, then you have an ample amount of T3 that is now available to go to the cell and get into the nucleus of the cell to turn on your metabolism. If that does not happen, you cannot have healthy thyroid metabolism. And there's one other place I didn't cover, is even after you get the T3, remember the cell is going to have a receptor here for the T3. If this receptor is not acting properly, if it's not receiving the T3, it can't get it into the nucleus of the cell, and you can still have low thyroid symptoms even though all your labs look normal. And there are things that can affect that, like cortisol levels that need to be tested if that is happening. So where all can this go wrong? Let's go through this briefly. Well, let's say that you've got a brain-based problem and you've got low TSH. This can be affected by stress. This can be affected by poor adrenal function. This can be affected because of decreased brain function. So if TSH is below 1.8, this is too low. If TSH is above 3, that's outside the optimal functioning levels. That is not hypothyroidism, but it's outside the optimal levels. Okay, so it could be a brain-based problem. It could be an adrenal issue, or what we call the HPA axis, the hypothalamus pituitary axis. It could be also a thyroid problem, and maybe you've got low T4. So if you've got low T4, that means that your thyroid, if you've got normal TSH and low T4, it means your thyroid's not producing hormone. If that's the case, then your thyroid needs to be supported nutritionally, or maybe with hormone replacement. Well, if you've got normal T4, then you've got low T3, then we know the problem is in the conversion. So if you've got, you could have a liver issue, the liver's not doing its job, or it could be a gut issue. If these are normal, you still could have a problem with your TBGs, with your thyroid binding globulins, and this can be affected by other hormones like estrogen and testosterone. And the way we would test this, we would run something called T3 uptake. This test will tell me if you have normal levels of TBG, because here's the problem. That hormone has to get off of this transport in order to get into the cell. If you've got too many TBGs, as soon as it gets off, another one will come along and pick it up, and you don't have very much free hormone. Or if you've got too little, it doesn't get transported to where it needs to go. Both of these can affect thyroid function. So this is an important test to be run. So here's all the different things that need to be tested, all the different areas where it can break down. And I'm going to tell you this, if your doctor's not running these tests, and if he's not doing and telling you where the problem is, and all he's doing is passing out a prescription, then 90% of people will not feel better taking thyroid hormone long term, even though they may need the hormone. And here's the other problem, the last thing I'm going to cover with you. The most common reason for low thyroid function in America is Hashimoto's disease, or Hashimoto's autoimmunity. Hashimoto's is an immune system problem, which means that your thyroid gland is actually getting attacked by your immune system. This is not a thyroid problem, this is an immune problem. And if that's not addressed, your symptoms will never improve. So to know if that's going on, you have to run 2 thyroid antibody tests. And if they come back negative, or you know it's not that, if they come back positive, you know that's your problem. So, I'm going to be teaching a workshop in our office. I want to encourage you, if you don't know this, or you're not working already with someone that's doing this for you, or if you think maybe you have a thyroid problem and you're not sure, attend this workshop. I'm going to go into not only how you identify these problems and where they break down, but also into some solutions. What do you do about it now? How do you get those symptoms under control, and how do you get your life back from low thyroid function? So make sure to contact our office or go on our website, clarkchiropractic.net. You can call us on the phone at 281-354-8330, and we'll look forward to seeing you at our workshop in our office. God bless and have a great day.